hearing loss can happen to anyone at any stage, especially children. They have childhood otitis media, things like that. And nowadays people listening to a lot of, used a lot of iPods and iPads and all these things and iPhones, all that. What happens is that they don't have sometimes control over the intensity level. So if you listen to loud music and loud noises for a very, very long time, that increases the risk of you developing a hearing loss. In addition, as we age, that happens something called age-related hearing loss. That happens. Age-related hearing loss starts in men after the age of 40. So the subtle changes take place by around 60 to 70. We can see a lot of hearing loss in 4 to 8 kilohertz high frequency region. So hearing loss can be prevented, especially if you can, from childhood to young age, and if you can take care of your ears and make sure you listen to music or whatever you listen to at a decent hearing level, around 60 to 70 decibel level, but not increase up to 90 to 100 decibels, and you can take care of your ears. But in the moment you start noticing that things like you have to ask people to repeat, you have to increase the TV or radio volume, then you're kind of struggling. So rather than postponing, it's really important you go and see hearing healthcare professionals, get your hearing tested, and get any suitable hearing rehabilitation device that's suitable for you. Because if we postpone it, what happens, we lead to something called auditory deprivation, and there are changes take place in the brain. We call areas that respond to sounds, they reorganize. We call them cortical tonotopical reorganization. So these changes do happen in the brain. So people usually wait for about 7 years to do something about their hearing loss, and that could be a bit late. So sooner you find out that you have a problem, it's better to do something about it.